Hello friends, I'm Dr. Puja Kapoor, Paediatric Neurologist, Director and Co-founder Continua Kids. So today let's have a word on prognosis in autism spectrum disorder children. It has been well studied that the trajectory of the development of a child who has been diagnosed with autism spectrum disorder, you just cannot define at the time of diagnosis. There are multiple factors which help in defining this trajectory. So let's discuss a few of them. So first of all the first is the cognitive skills of the child. It has been well documented, well studied that all those children who have better cognitive skills or have a higher intelligence quotient, they do have a good prognosis as compared to their peer age group with the same diagnosis. Their prognosis is much better, they have better social skills, they become much better later in life as compared to the children who have lesser intelligence quotient. The second is the time of introduction of the intervention program. Again, it has been well studied and documented that all those children who have been started with the early intervention program or the age of the start of the intervention is much earlier, they are much better, they have a better prognosis as compared to children who have been introduced later with the program or later with these therapies. The third is the presence or absence of stereotypes or what you call as repetitive behavior. So all those children who have stereotypes, they have worse prognosis as again compared to the children who have lesser of stereotypes or lesser of repetitive behavior. Also, looking at the normal trajectory of the development of autism spectrum disorder, it has been found that 8 to 9% of the children who have been diagnosed with autism spectrum just lose these tag and they are categorized as normal individual in late adulthood. Also, there is a study which tells us that the standard of living or the quality of living with children who have autism spectrum disorder is if the support of the family and the community is there, the quality of life is much better in spite of having the symptomatology. Their standard of living is much superior as compared to children who do not have this support. So this is all I have for today, and let's catch up some other day. Thank you for the patience for listening. Thank you.